Start, please.
Hello, everyone. A very warm welcome to all of you joining us today from across the United States and Canada. On behalf of NDS North America Group, I sincerely thank each one of you for taking the time to be with us. NDS North America Group has been serving our community under the guidance and inspiration of BB Chauhan. I encourage everyone to stay with us until the end of the session and actively participate in the live question and answer. If you have already submitted your questions through our online form, those questions will be taken on priority. We sincerely thank Dr. Bimal Chhajer for accepting our invitation and sharing his valuable time with the NDS North America family. Now it's my pleasure to invite Mr. Dipak Parekh, who will introduce our guest speaker, Dr. Chhajer. Here is Dipak Bhai. Done. All our online form, those questions will be taken on priority. We sincerely thank Dr. Bimal Chhajer for accepting our invitation and sharing his valuable time with the NDS North America family. Now it's my pleasure to invite Mr. Dipak Parekh, who will introduce our guest speaker, Dr. Chhajer. Here is a Dipak Bhai. Deepak bhai, go ahead.
Good evening, everyone. It is my privilege to introduce Dr. Bimal Chhajer, a cardiologist, preventive cardiologist who has pioneered non-invasive cardiology in India. Dr. Chhajer was a former consultant to AIMS, New Delhi, and founder of SAAOL Heart Center, and has dedicated his career to helping people prevent and reverse lifestyle-related heart diseases throughout evidence-based changes in nutrition, exercise, stress management, and healthy living. He has guided thousands of patients in India and around the world and better heart health. Please join me. Warm welcome to Dr. Chhajer, Dr. Bimal Chhajer.
Good morning to you. I must thank Dipak Bhai, Punita Ben for inviting me to your forum. Today, heart disease is the most important and most fatal disease, and it affects everybody in the world. About 30% of deaths of India are because of heart, and this can be prevented if we analyze the cause of the disease and try to solve the disease from the root cause. And this is what we are doing. In India, we have about 143 clinics. We have about 6 clinics abroad. We have 3 in Bangladesh, 1 in Nepal, 1 in Dubai, and now we are opening Mauritius clinic in the next month. We treat heart disease in a different way. We tell people that there is no need of a bypass surgery or angioplasty, but we can reverse the disease. There is no risk of heart attack as well. People, when they suddenly realize they have heart disease, by that time the blockages have already crossed 70-80%. You know why? Because our body has been, our heart tubes have been given 70% extra. So if the supply is 100, our requirement is only 30. So 70 block, even if you do, there is no problem to the patient. When you touch that requirement part, that is 30% part, then only the symptoms come, and then only the patient suddenly realize that he has got a heart problem. But heart disease can be detected well in advance, and I'm going to give you the whole story about heart disease in the next 35-40 minutes. And I'm going to tell you what exactly people can do to detect heart disease well in advance and then take care so that the blockages don't grow. Unfortunately, those people who have already developed the blockages, those people also can reverse the blockage. And how to reverse is what we are going to talk to you. Heart disease and other disease are the difference. Like we have infections, we have, malaria, we have other diseases where you have to just solve one cause and the problem is solved. Thyroid problem, any infection. But heart disease has multiple factors. It is not one factor, oh, cholesterol we control, our job is done. No, triglyceride, blood pressure, sugar, obesity, so many reasons. So it's called multifactorial disease, and all the factors need to be addressed. And then only we can solve the heart disease. And this is what you have to understand in this. And then I must tell you, there are some non-invasive treatments. One is called natural bypass or EECP. This is a US FDA approved program and it is paid by the Medicare in USA. This treatment where you don't have to cut the body, you have to just open the extra set of tube God has provided us with. We tell people there are two sets in the heart. One that is outside the heart muscles which supply the blood called coronary arteries, and one inside the heart muscles, which are collaterals and capillaries. So God has given us a backup tube inside the heart muscles. And if you can open that, there is no need of any surgery from outside, cutting the body, pasting the cut tube from the leg or hand to the heart muscles. That is not required because we have already one set extra in the heart. And I'm going to tell you how and what and all that. So this is what I'm going to talk to you. I have been few times to Los Angeles and I have been lecturing all across USA. I have lectured in Houston, New Jersey, Boston, Bay Area, and of course, LA. So nevertheless, when Dipak Bhai requested me, I said, okay, why not? I'm here in Dehradun, and if we can talk to so many people abroad, there is no problem. So I'll now go and show you some slides about heart disease. I have written, I was just overhearing, I have got about 12 books in Gujarati. All the cookbooks are all there. And there is a Gujarati publisher called RR Seth. They have published all my books. So we've got about 70 books out of that. About 12 or 13 are translated into Gujarati. Nevertheless, let me share the slides to you and let me see. Can you see the slides, please?
Yes.
Yes.
This is a world picture. See, the violet ones are the countries where heart disease is highest in number. You will see China, you will see Russia, and you will see US also. India obviously is there. You will see all the countries which has highest number of heart disease patients. And US is one of them because though the awareness has worked very well over there, the heart disease is not increasing or almost in the same range, but at least it is not growing in US. But the Indian community in US, as you know, are very prone to develop heart disease because they've got Indian genes and they've got the lifestyle of US. So I'm going to talk to you about all that. Let's see, this is what happens. If you see the China and India stories are very bad. They are growing the blockage, and the West, including the US, they are almost controlled, but still they are higher than India. But heart disease kills about 1/3 deaths all across the world. 1/3 deaths are heart disease related. So we have to know what is heart disease. I'm going to first tell you what is heart disease and then explain what are the things we can do. Cause of 30% deaths. So you can imagine, and Indians abroad have the highest rate of disease amongst all communities. Remember, the number of heart patients are increasing for simple reason that our lifestyle is bad. Our food habits are bad. We don't have time for the exercise. We are under stress. And often we do not do exercise. We remain obese. We smoke. All these causes lead to heart disease. So when we want to solve the heart disease, it is not fair enough to put a new tube and try to allow the disease to grow again and wait for the next bypass surgery. We always tell the disease should not grow. We already know the reasons. The biggest trial that was ever done in the world is Framingham Heart Study, which is Framingham, as you know, is a suburb of Boston, where they carried out a research on heart disease for about, after the World War II till now. So about 70, 80 years they have worked on the communities, and then they have all discovered the reasons of the heart disease. So all these reasons are known. We have to only tackle them. And this is what I'm going to talk to you. But most happening things are now for heart disease is, one, we can diagnose heart disease well in advance. You don't have to wait when the blockages cross 70%. Anytime you want, it can be done. And in this is called CT coronary angiogram. I would say in the last 20 years or 30 years, the best thing that has happened to the medical science is coronary artery angiogram, CT angiogram. And what is that? You just scan your heart and you'll know the blockages, in which tube, how much percentage. Even if you have 10, 20, 30% blockage, you can find out. And this test is now very popular in India. And the cost, you know how much it is? About 7,000, 8,000, 9,000 rupees, less than $100. I have seen a lot of my, friends coming from US, coming to India and getting this CT scan done, because in US, this is same thing is $4,000 or maybe $3,500. I was told by Nitin Shah, Dr. Nitin Shah, if you know him, that he has arranged somewhere $500, they will get it done. But nevertheless, $500 is also very high. So this CT scan, anybody can do and know the blockages. And research has shown that the heart disease is reversible. Reversible means whatever blockage you have grown, that can be reduced. And this has been proved by one Dr. Dean Ornish, who was working in the Bay Area, San Francisco. He is the first person who showed to the world with all the proofs that the blockages that has developed over the years can also be reversed. And his trial was published in the most prestigious medical journals called Journal of American Medical Association, Lancet, New England Journal of Medicine. So it's a known fact that now the blockages can be reversed. Then the third thing that has come is natural bypass or ECP therapy. What does it mean? As I told you, we have an extra set of tube in the heart, and that if you can activate, there is a second set ready. It's something like when somebody takes a bank loan in India, they need a collateral. That means somebody guaranteeing that if there is a failure on part of the person, I will support him. So that is how God has given us extra set of tube in the heart muscles, and these tubes are activated by running by the sports people. When the sports people go for training, they are asked to run for hours, and that opens those extra tubes. And this, for the heart patient, we can't allow them to run. So there is a machine which allows them to run while he is sleeping. He's lying down on the bed, and the muscles of the legs are squeezed repetitively to open the heart extra tubes. The fourth thing that I always say is the zero oil cooking process. Oil has no taste. Oil is a fat, and if you want it to get deposited, you go to your kitchen, and just by the side of the gas burner, you touch the wall in the evening, you will see there is something sticky material, and that is nothing but oil. And this oil also grows inside the heart tubes and block the tube. And this oil has a medical name called triglycerides. We only knew about cholesterol till some time back, but in the last 3-4 decades, triglyceride has also become so important. And we want people, and this oil, all the oils are triglyceride, whether it is olive oil or rice bran oil or any oil, all the oils are called triglycerides. So if you go to a pathology lab and tell them, okay, I want my rice bran oil or olive oil, they will say, no, we'll write triglyceride. All the oils are equal. It's something like the water has so many companies who produce water, but water is water. All the companies have the same product called water. So similarly, all the oils are nothing but triglyceride, and this oil has no taste. If you touch the oil and put it in your tongue, you will see there is no taste. We are using oil because we have been trained like that, okay, we have to fry the spices with oil. But we have developed a process called zero oil cooking, where the spices can be fried with water only, with sprinkling of the water. And this zero oil concept has become viral all across India. I have an Instagram video on zero oil cooking, about 1 minute, which has done about 500 million views. So zero oil. And another one is called drum theory. What is drum theory? Very simple process. There is a drum where there are 14 holes. If we want to fill up the drum, we have to close all the holes completely. That means heart disease has 14 reasons, and all the reasons have to be controlled if you want to control the heart disease or reverse heart disease. Not that you will do one, or some people come, sir, I have reduced my weight, but my BP is high. I've reduced my BP, my sugar is high, my cholesterol is high. We have to control all the 14 things together. Then the results will come very well. So this is what I'm going to talk to you now. So these are the few things which has become, I always say these are the 4 things that has changed the whole concept of medical science in regarding heart disease. Now, let me explain in short what is heart disease. You can see the heart over here. Heart I am showing bigger. Heart supplies the blood through this big arrow to the whole body. This is called aorta. And at that time, heart muscles, they need blood because the muscles keep on contracting. These muscles need blood. So they get 3 tubes from the main tube called the aorta. One on the right side called the right coronary artery. 2 on the left side, one in the front called left anterior descending LAD, and one on the left side back called left circumflex. These 3 tubes, what is the diameter? The diameter is something like this pencil, about 3-4 millimeters, 5 millimeters, 6 millimeters. That means half of a centimeter. That is the diameter of these tubes. And inside these tubes, the blockages happen. You can see there are 4 tubes. I have shown the cross section. One has 0 blockage, one has 10% blockage, one has 30% blockage, one is 60-70% blockage. And irony is that till 60-70 people have no symptoms because they have given extra. So people don't realize they have got 70-80 till they start getting difficulties. And once the difficulties come, the blockage is already crossed 70. I'm just showing how a blockage grows. You will see a person at the age of 60 years have blocked the tube by 80%. But at 60 years, if he's got 80% blockage, he has been detected to have heart problem. He had 50%, he had 40%, he has 30%, 20%, he had 10%. So the blockages always start at the age of 20. And suppose at the age of 60, somebody comes to know that's long 40 years to develop the blockage. So the blockages don't grow very fast, they grow slowly. But if you are, if you carry a lot of risk factors, lot of bad habits, you are smoking, you are overweight, you don't exercise, you are stressed, then the blockage speed can increase. And if it goes to suppose 40 years, 80 blockage, that means 2% per year. But if you are taking all the risk factors badly, then you may grow at the speed of 40. That means at the age of 40, you become a heart patient. So there are a lot of people nowadays who are developing heart disease at the age of 30, 40 because their lifestyle is really bad and they grow the blockages faster. So that means the speed of the blockage does not depend on God. It depends on ourselves. Obviously, there is a genetic reason also. Genetics means our body's genes are so that the cholesterol and triglyceride, these are the 2 deposit items, they grow, they are manufactured in the liver in a high number. So if somebody has a genetic tendency, they will get heart disease earlier. But if they can control cholesterol, triglyceride artificially or by changing food habits, genetics also become nullified. So genetic part can be nullified by taking cholesterol lowering drugs and changing the lifestyle food habits. So nevertheless, so if I have to say in one sentence what is heart disease or coronary heart disease, which is the most common disease, it says that heart has 3 tubes which are called coronary arteries, and inside them when the blockages grow 70-80%, then it is heart disease. You must have heard from the doctors, heart disease is atherosclerosis. It is oxidized LDL cholesterol being engulfed by the phagocytotic action of monocyte. These are all medical jargon. Simple term, simple sentence, heart disease means more than 70-80% blockage inside the three coronary arteries which supply blood to the heart muscles. Now, when a heart disease comes, what is the difficulty? When the blockages cross 70-80%, then person says, if I walk, if I climb, I get a breathlessness or I get a chest pain on the left side. And if I walk further, the pain will increase. But if I stop, the pain will go down. This is a typical story of heart disease, and it means the blockage has crossed 70-80%. So people will only realize when they start getting angina. Angina is, these are the things. Angina means either chest pain on the left side going to the left arm, or breathlessness, or choking on the throat, or even burning sensation in the, and all will be related to exercise. If I do physical activity, then the pain comes, the difficulties come. When I stop, it stops. And this obviously means the blockage has already crossed 70-80%. Now, when people go for an angiogram, the blockages are discovered. The problem is the people don't realize that the blockages will only give trouble when they cross 70. They realize it is too late, 80 is gone, so we are nothing left out. And hospitals also create a kind of panic so that people immediately go for surgeries, angioplasties. But if you realize that the blockage has grown over the years, now, why people worry about heart disease? Because of a condition called heart attack. Now, what is a heart attack? Let me explain. 70-80, I told you, is angina. When the blockage becomes 100% block means completely blocked, then it is heart attack. Now, how does it happen in a minute? You've heard heart attack suddenly happens. What is the reason? The blockages, if you see, the blockages, when they grow, they are two walls. One is outer wall, which is very strong. I'm showing with this arrow. And one is the inner wall, which is weak. So when the blockages keep on growing, the inner wall is pressed. It is stretched and stretching. One day the inner wall will burst, depending on the stretchability of the wall. And this stretchability varies from person to person. I get people who at 90, they have not broken the inner wall. And at 70, at 50, people have broken the inner wall. So a lot of people come, sir, I never had a heart problem, and suddenly heart attack happens. They probably had 60, 70 blockage, and at this condition, they believe they have no heart problem because the symptoms are not there. And one fine day, the membrane bursts, the wall bursts, and immediately there is a clot formation. Understand how this heart attack takes place. This is a zero blockage and the blood is there. This is a cross section of the tube, normal artery. This is about 70-80% block. Patient does not even know that he's got a 70-80% block. And the blockage is still growing. This wall will one day snap. As soon as the wall snaps, chemicals are released, they mix with the blood and the blood clots. And once the blood clots, it becomes 100% block. So heart attack happens if you keep on incessantly growing the blockage. One day the membrane will burst. So we tell people, if you grow the blockage, then the heart attack will take place. But if you don't grow and if you reverse, the heart attack will take place. And this is what is the logic that you have to understand. That heart disease, the blockages have grown over the years. Now you stop growing, there is no heart attack. I give an example to my patients that there is a bundle of notes with a rubber band. And you are putting more note, rubber band will burst. If you don't put notes, the rubber band will stay. And if you start reducing some notes, then the rubber band will de-stretch and the heart attack will never take place. So simple as that. If you don't grow the blockage, heart attack will not happen. And if you reverse, nothing will happen. Then you are cured also. Now, this is what is the theory. You have to understand that heart disease. Now, what has happened today till now? You have understood what is heart problem. You have understood what is heart attack. And how does it happen? And the day the heart attack happens, what will be the difficulty? I told you our heart's requirement is only 30%, but that is only when you run, 20 when you walk, and 10 when you are sitting. During heart attack, that 10 is not available, 100 is blocked. So that time you start getting pain or same symptoms at rest. I told you when you walk, you get a symptom, that means 80, 90, 70 blockage. But when it is at rest and there is a sweating and associated severe pain, it means the blockage has become 100. This is called a heart attack. And in heart attack, I'll also tell you one very simple thing. You must have heard something called a minor heart attack and a major heart attack and a massive heart attack. Just I'll take a few seconds to explain to you. Suppose this is a tube I'm talking about, LAD. Now, where can the blockage happen? Answer is anywhere. Suppose the blockage is at the last end of the tube and the heart attack takes place, only this much will die, only small area will die. This is called a minor heart attack. But suppose the blockage is not here, but here in the beginning of the tube, then the whole area will die. Then it is called a major heart attack. And suppose the blockage is at the beginning of both the tubes together, called left main, then a heart attack will mean only death. The patient cannot reach the hospital even. So it is the location of the blockage that matters. If the blockage is towards the end, heart attack, even if it happens, people will not die. Even 5 attacks, they will survive. And 1 heart attack in the main tube, people may die. So basically, heart attack should not happen. So and where is the blockage? How do you know? CT coronary angiography. One simple test can tell you how many blockages, percentage of blockage, and the location of the blockage. Nevertheless, now let's see the solution. Now, this is what is the conventional angiography most of the people do. This is where they put the wire either from the groin or from the wrist, and they push the wire to the body. It's an invasive test, and for that you have to get admitted. And this angiogram tells us roughly the blockage 70, 80 or 90. You will see always they are rounded off. They are never 77.3, 82.9. It is 70, 80, 90, 100. Why? Because they are all rough figures. They are not exact figures. But people get worried, oh, 70 block, then heart attack will take place. It depends on the stretchability of the membrane, strength of the membrane. The membrane may not break at 70, 80 or 90 if it is strong. But we do not know. So, and this is CT angiography. You can see here you have to lie down. They'll give you injection and there is a X-ray of 1 second. 1 second to 5 second X-ray and you know the blockage. And this is the best test. After the heart attack, depending on how much heart is damaged, echocardiograph can tell us how much is the pumping power. If the heart is not damaged, then the pumping power of the heart is 60. You can see the echocardiogram report. 60 is our normal pumping power of the heart. 60 means when the heart is big, it has got 100 volume. When it is small, it is 40 volume. That means 60 is thrown out. So a normal person's heart, if we do an echocardiogram, the pumping is 60. Suppose there's a minor heart attack, small area is damaged, the pumping power will become 50, 55. If there is a major attack, then it may come to 30. But remember, for being alive, we need only 15 to 20% pumping power. So God has given us enough extras. So our minimum for being alive is 20 and God has given 60% power. So heart has plenty of power. So small heart attacks don't make you die. But when it is a large heart attack, major heart attack, then it is difficult. But tell me one thing, which heart attack is allowed? None of them. Remember, no, whether it is minor, major, massive, none of them is allowed. And this is Dr. Dean Ornish in San Francisco, his office, I'm there. And this is the person who showed to the world with so many research. You will see Journal of American Medical Association, Lancet, American Journal of Cardiology, and then New England Journal of Medicine, American Journal of Cardiology. All these published data shows that the blockages can be reversed. Now, what is the theory? Very simple theory if you understand. What is the item that is depositing? It is the fat which is depositing. Now, what is the name of the fat? Cholesterol and triglyceride. These are the deposit items. Cholesterol can be obtained from 2 sources. One, body manufacturing, that is internal, and external is from the food. Now, remember, cholesterol is present only in animal food. Animal means all the meat, chicken, mutton, fish, and eggs. They have plenty of cholesterol. So I tell heart patients to become vegetarian first, plant-based food. And the milk is also one of the animal foods. So remember, when you want to take milk, remove all the fats. So you go for the green, milk, that is skimmed milk or double tone milk. That is good for the heart, but don't take plenty. Milk and milk products are also restricted. So cholesterol down, to reduce cholesterol, we have to do 2 things. No animal food. or minimum animal food in the form of milk. Milk is an animal food, remember. But what is triglyceride? Triglyceride is oil. In the oil, they will write often zero cholesterol. Oil has no cholesterol because it's a vegetarian source. Only two oils have cholesterol. Which are these oils? Cod liver oil. That has cholesterol because it is from animal. And ghee made from milk has cholesterol. Ghee is both cholesterol and triglyceride. Ghee, I call it milk oil. This is again a triglyceride, but some cholesterol is also there. Now, zero oil cooking is to eliminate the triglycerides from the food. So we have to cook the food without oil. Our 80% of the oil intake is completely gone, but 20 still remains. That is the oil which is already present in rice, chapati, any vegetable, any fruit. God has given us some innate oils in all the foods that we eat. So we don't have to add separately from outside. That is the theory. 80% of the oils that we take are not required. 20% already God is given by natural food. So we have adequate oil even if we don't take oil from outside. So this is what you have to remember. And then if it is a genetic case where the body is manufacturing a lot of cholesterol, triglyceride, we have statins, we have now bempedoic acid, we have now ezetimibe, we've got plenty of cholesterol lowering drugs. And for triglyceride, we've got fenofibrate. In India, this is a beauty that you can go and buy any medicine from any shop within 5 minutes. In US, you have to take an appointment with the doctor, and if he only allows, then you can take this medicine. But we are comfortable in India and the medicines are not costly. In India, one statin tablet is 5 rupees. In US, it is $5 maybe. But anyway, nevertheless, these medicines can save our life if it is a genetic case. But if we are only in wrong food, then we have to change. In Bangladesh, I must tell you, people take meat 3 times a day. And we've got about 50,000 patients in Bangladesh who have become vegetarians. Nevertheless, now what are the other factors? If you see, there are some speeding factors: blood pressure, sugar, obesity, smoking, tobacco, alcohol, and stress. These speed up the blockage. So what does it mean? Because of the cholesterol, triglyceride, somebody is going to get a heart problem at 60. If he has high blood pressure, he may get at 55. If he has got high blood sugar, then he may get at 50. If he has got obesity, then he may get early. If he is smoking, then early. So if all the factors are present, the blockage will come faster. And then oil in the food, not walking, not doing exercise, yoga, and not eating fruits and vegetables. These are all the reasons that lead to blockages. Now people say, sir, who will control what? I want all of them at the lowest bracket. Suppose cholesterol is 130 to 200. I'm looking for 129. Lot of people have a habit. Now my sir, cholesterol is 200, which is normal. I said, what normal? It is towards the last end. I give an example to people. If I want to buy a pen from the market and I've sent my guy, okay, buy this brand only. He calls me from there, sir, 130 में मिल रहा है, 150 में मिल रहा है, 200 में मिल रहा है, किससे खरीदूं? I'll tell him 130 से bargaining करना. That means we have to go to the lowest. We have to go to the lowest, not the highest of the cholesterol. This is how we change the patient's mental, setup. I tell people, look, I want the best. So best is 130. So you get below 130. So if you can do that, then the cholesterol does not block. And triglyceride also, I want at the lowest. Blood pressure at 120/80, sugar at 100 and 140, fasting 140, PP 100. And I want obesity to reduce. I want tobacco to stop immediately, alcohol to minimize or stop, and the stress to be reduced by yoga, meditation, walking to be done. Now, all of them together can reverse the blockage. And who will do what? I have got 3 people to do things. One doctor who can reduce the cholesterol, triglyceride, BP, sugar, manage the blood thinners, and give the anti-anginal medicines. Second is the patient who has to walk, who has to do yoga, who has to stop tobacco, who has to reduce weight, and he has to cut down stress. And the family has to provide zero oil cooking, vegetarian food, fat-free milk. And another one is dry fruits. Remember, this almond and cashew nut and coconut and pistachio and this groundnut, all of them have lot of oil. They have 100%, harmful for the heart. Why? Because see, I do not allow 1 drop of groundnut oil, peanut oil, and I allow you peanut, then the oil will go inside. So I always ban these dry fruits which has oil. Dry fruits like raisins, dates, figs, they are allowed. They don't have any oil. So if you want to reverse, then no dry fruits as well, and plenty of fruits and vegetables. Now this is the theory of reversal. I've got a very beautiful chart made for my patients. These are all the factors around. You will see a wheel around a circle where there are 14 lines. Each line is the spoke of the wheel, and there are 3 areas: red, yellow, green. Red means you are growing the blockage. Yellow means you have stopped the blockage from growing, status quo. And if you are in the green zone, then you are reversing. That means red, you are putting more nodes into the rubber band. You are looking for a heart attack. Yellow means prevention, and green means reversal. So I want my patients to get all the 14 factors to rock bottom, then the blockage start reversing. And this is the beauty of the process, that people can very knowingly know all the factors. They will understand, and they will bring all the factors on their own. And if they need a doctor's help, they can always get the help. This is the drum theory I told you. If there is a drum with 14 holes, we have to close all the holes if we want to fill up the drum. So for reversal, we can't allow one thing to go haywire. All the factors needs to be controlled. We have a beautiful resort in Dehradun where we train people to reverse the blockage, and they stay with us for 40 days. And these days these are my books. This is a book called Reversing Heart Disease in 5 Easy Steps, and this book has been published in Hindi, Gujarati, Punjabi, Bengali, Kannada, Telugu, Tamil, Marathi, and Malayalam. So 5 steps are for reversing is education. What I have given you in the last 30-40 minutes is the education about heart disease. And diet is 0 oil, no non-veg, lot of fruits and vegetables, and milk to be restrained, and then nuts to be cut. And stress has to be reduced to 50%. Stress cannot be 0. So we have a training where we can reduce the stress. We explain to people the analogy, plus we treat them with yoga, meditation, and they have to walk, plus medical management if required, and whatever required. This is another new concept that I'm going to tell you about, ECP, called natural bypass. This is a beautiful machine which is US FDA approved. There have been 200 research studies, including multicentric randomized control trial, through which the US government approves this treatment. And in this treatment, patient has to lie on this beautiful bed, and the jackets are there around the muscles of the leg, the thigh muscles. This is how the legs are. And I'll just show you first. This is how the patients are put on the jackets. The jackets are covering the hip muscles, if you see, the thigh muscles, and the cuff muscles. And the ECG is fed to the computer. Now, how does it work? When the heart pumps, the jackets become relaxed, so blood fills up the leg muscles. And then when the blood is returning towards the heart during diastole, the leg muscles are squeezed, and the blood goes to the heart with a higher speed, higher volume, and that opens the collaterals. And this goes on for 1 hour, where the heart pumps about 4,200 times and machine pumps for 4,200 times. And during this time, the collaterals are opened. And if you see the collaterals, this is the tube I told you going from outside. This is blocked. And these tubes are the collateral tubes, and they are the supplier of the heart muscles, and they are all joined together. So if you can join these, then we have a duplicate tube. We don't need a bypass from outside. We have a duplicate tube inside the heart, and these duplicate tubes work very well. So this is how the reversal takes place, because we have a next set of tube which is opened. So we have now 2 tubes. One is blocked, one is opened. And this blockage tube can be reversed, then there is nothing to worry. And what is the net result? I'll just show you. This is the net result. These 3 tubes, which were initially on the outer surface of the heart, they become like this. These thousands of tubes extra has been developed, and this is through the machine. And this treatment needs about 35 to 40 days. And that is what we want people to stay with us. In USA, if you just write ECP, every big city, big hospitals have ECP. Only problem is the cardiologists don't like it because they don't give them a lot of money. They say, no, we would look for CABG and angioplasties. And this treatment has been put in the last. Okay, when both of them fail, then you can go for this. But I always tell people first choice should be this. And then if the person wants to cut the body, invade the body, then the other things can happen. This is a book called Yoga for Reversal of Heart Disease. These are my books on tips on diabetes, 201 tips on heart disease, on diet, on losing weight, on blood pressure. We have a weight loss program as well going on in our resort. All the books are translated into different languages. These are my cookbooks. Zero oil cookbook, zero oil snacks, zero oil thali, zero oil sweets, zero oil South Indian cookbook. And all these books are translated into different languages. I've got a lot of books which I've written: allergy, anger, diabetes, constipation. And I think these are all Hindi books. These are all Bengali books. I think these are Gujarati books by R.R. Seth. So if you go to Ahmedabad or any place, we've got 6, 7 clinics in Gujarat. We've got one in Vapi. We've got one in Surat, one in Baroda, Anand, Ahmedabad, and Rajkot. These are the clinics where this natural bypass can also be done. These are Marathi books, South Indian books. So nevertheless, Dipak bhai, I've almost covered what I wanted to tell you, that heart disease is caused by certain reasons which are very clearly known by us. And these reasons can be reduced by a collaboration of the patient's family, patient, and the person who's treating. And both of them, all of them together, if they work in tandem, they can reverse the blockage. And it is not a very difficult thing. We have already treated 750,000 people, 7.5 lakh patients in India. And not only patients, if somebody has a 50% blockage, 60% blockage, they are not called heart patients, but they can also reverse so that in future they don't get heart attack. Nowadays, it is very common for the young people to get heart attacks. So this CT angiography must be popularized. I have been to US few times, maybe about 20, 30 times, and all the time I've tried that this test should cost much lower, like in India. Because once you buy the machine, then everything is free. Only manpower, obviously manpower is very costly over there. But these pictures can be taken. For a radiologist to report it, they will ask for maybe $200, $500, $1,000. Now these can be done from India, like we have these back offices of companies inside. So this can be done. A radiologist in India would charge 500 rupees happily and do the testing, do the reporting. So nevertheless, I believe future is very bright and heart disease can be eliminated. We have now started an NGO which is called Punya Heart Foundation. And the aim is to reach this knowledge which I have given you to the whole of the country, 150 crore people. And obviously, if it is online, it can go to everywhere. So we are making a film on how this heart disease happens and how a heart attack takes place and how we can reverse the blockage. This film will be about 15 minutes. And this can be given to everybody all across the world. And this film is coming up, and this NGO plans to start showing this film to all the 800 districts of India. Every corner, every school, every college, we want to educate. And this, I believe, we call it heart vaccine. Heart vaccine means you have to, it is not a physical vaccination, it is the education vaccine. So nevertheless, I must thank Punita Ben, Dipak Bhai for, asking me for holding this seminar on Zoom. And I believe all of you have understood little more than what you have already known. So thank you so much. And now I think I'm open to questions.
Okay.
Okay, we have a first question from Anisha. I'm Punita. How to cure blockage from the heart vein without any operation like stent or bypass surgery?
I think already answered.
Correct.
You have to control all the 14 factors. You have to change your diet. You have to walk every day, to do yoga, and the blockage will start reversing. The speed of the reversal is about 1 to 2% per year, the way it has grown. But even if you can reduce by 2%, it is good enough. But in India, we give another therapy called antioxidant detox therapy. And that therapy can reduce the blockage faster. If you want a 10%, 15% reversal, then it is better to come over here and do the treatment for 40 days.
Sure. The next question from Bimal Shah. Things to take care after scan.
Same thing. All the things are same. You have to control the sugar, control the BP, you have to reduce the weight, you have to walk every day, you have to eat the zero oil food. And zero oil, we've got 1,000 recipes. We have a cooking channel in YouTube called Zero Oil Cooking. You can just go there, write zero oil cooking, it will come. And we've got some million subscriber already over there, and 1,000 dishes without oil.
Okay. Next question from Varsha Parekh. Lately, I'm having a faster heartbeats, or I can hear heartbeats actually. Sometime when I walk or climb the stairs, I am out of breath. My BP medicine is changed, is better now, but I still feel something has changed. Is this anxiety or something else?
See, if the BP is there, I don't know what is the weight. One of the risk factors of heart disease is BP, and if she has got a breathlessness, I think you should go for a CT angiography. But the blood pressure must be controlled to 120 by 80. That is my, agreement that I want all my patients to go to that. And in the blood pressure tablets, there are a few tablets which can also lower the pulse rate. So if somebody's got a palpitation, so we give them a beta blocker, and that can reduce the pulse rate as well, along with the blood pressure. So she should look for a beta blocker. I don't know what medicine is prescribed, but this medicine can be changed. I can, but only problem is you can't buy it over there. So you have to take the medicines from here on.
Oh. Sometime in the Ayurvedic, they are saying that we should take ghee. So, and we are totally like, now we are talking about here no nuts and zero oil. So, yes. What to do?
Veda is a science which is 2,500 years back. Now, at that time, people used to do a lot of physical activity. They have to plow the ground and they have to work hard, very hard physically. They would digest all the ghee. But now, scenario has completely changed. We don't have time to do exercise. Now, if we take ghee, that will deposit. We are not utilizing this fat. So ghee is now banned for most of the people who don't work. I know somebody says, sir, I walk 3 hours per day. That's different. But for others, mostly they don't walk more than half an hour in the whole 24 hours. So I would not recommend ghee at all, and it should be completely eliminated. A lot of people say, sir, without ghee, without oil, the joints don't work. But that is all fallacy. The joints need lubrication by synovial fluid, which has no oil in it. And oil does not lubricate. I have seen so many people in Delhi, the fat ladies and gents, eating all the ghee, and still the joints are all spoiled.
How we get the omega-3?
It will come from the invisible fat that is already present in all the foods. Like rice has 1.5% oil, chapati has 1% oil. We have all the ragi, bajra, jawar, all of them have some oil. And even dals, all the dals, pulses have about 3 to 5% oil. So all these, if you take, we have a research already carried out. Even if you take zero oil, our minimum requirement of fat in the body is 10% of the calories. That comes from the cereals and the fruits and vegetables. Even if you take 4 tomatoes and make a soup out of it, you will see 1 or 2 drop of oil on the top, even if you have not added any oil, because that tomato also has some oil. So you do not need it from outside.
Do you believe in gym to go to fitness?
A heart patient is knowing that he's got a very good physical fitness. Gym, you can do walking very well. And even if you want to for weightlifting, don't lift very heavy weight. maybe go for 2, 3, 4, 5 kilos and do it 10 times more than what you have been doing with the heavy weights. The muscles will develop. So gym, I have no problem. Only hard physical activity is not allowed if you're a heart patient. But if you can test your heart and know that the blockages are not at all there, then do whatever you want to do in the gym.
Correct. Deepak bhai, go for it.
Yeah. Okay. Anil Shah from the Ahmedabad. He says, how to cure the blockage, heart vein without operation. You just talked about
No,
that.
I did that. You need to go by Sashi
All
Jalota.
these questions have come, all these questions have come before the lecture. So
Correct.
now after the lecture, somebody has questions. Answered.
Yeah. Okay. Let's. Yeah. You want the live questions. Yeah.
Sashi
Okay.
Jalota.
Can I say my question, please?
Yeah. Go ahead.
મારો ક્વેશ્ચન છે, મારું નામ પારુલ છે, પારુલ અને અશોક શાહ. અને મારો ક્વેશ્ચન એ છે કે આ કેલ્શિયમ સ્કોર હાઈ હોય કે એ રીતે તમારું જો એટલો રિઝલ્ટ બહુ હાઈ હોય કેલ્શિયમ સ્કોરનો, તો વોટ ડઝ ઇટ મીન? અને સેકન્ડ થિંગ, EECPની જે તમે વાત કરી, is it possible in California, because we are in Southern California? So do we have to travel all the way to India to do the treatment?
No. Let me explain. First, ECP is very much available in whole of the USA. But
Oh,
only thing that standalone ECP, doctors, they promote it. But most of the heart hospital doctors who go for stents and bypass surgeries, they don't promote ECP so well. So you will get a resistance from your cardiologist when you want to look for ECP. But in India, it is all free. You can go to anybody and you can ask, okay, I want to do ECP. They have to agree. So if you just write ECP and write California, you'll get so many ECP centers. I've got one Manu Bhai Shah who has done ECP in LA so many times, and he had a bypass surgery and he came in contact with me. He has done ECP in LA area.
yeah, no, I know him
It
personally.
is the calcium score.
Go ahead.
Calcium score is only an indication that you're getting older. As you cross age of 40, the bones get demineralized, the calcium is taken out from the bones and they are deposited in the whole of the body. So always in the CT angiography, you will find a calcium score. They are not dangerous. They only indicate that maybe some blockages are there. And these blockages are 99% made from cholesterol and triglycerides, and only 0.1% or 0.5% calcium. So don't worry about the calcium score. In fact, they are beneficial because they give strength to the membrane. The heart attack chances become reduced.
ને ખાસ એ પૂછ્યું હતું કે સપોઝ યુ હેવ 90%, હમણાં કરાવ્યું હતું હાર્ટ સ્કેન, તો સપોઝ એ લોકોને એક્ઝેક્ટ ખબર નહોતી કેટલા પરસેન્ટ, બટ લેટ્સ સે 90 or 90, વી ડોન્ટ નો, બટ લેટ્સ સે ઇટ ઇઝ 90-95%. So at that stage also ECP will help?
Yes. But along with the ECP, remember you have to do all the lifestyle changes which I have advised you. वो भी करना पड़ेगा.
હા, એ બરાબર છે, પણ you can start that even if you are scheduled for
You
angiography.
started 0 hour now, right now, today onwards.
Yeah. ના, જીઓગ્રાફી સેટ કરી હોય કે બી ચાલો 3 વીક કરવાની છે, તો એ પહેલા આ કરી લઈએ તો ચાલે?
हाँ, आप मेडिकेयर इसको पे करता है, and I think lot of insurance company is now paying for it.
હા, મેડિકેર does.
Yeah. That's true. That is true. Paruben, what do you need to do? Paruben, what do you need to do is you need to start the ECP treatment right away, and better place to come and do all of it together, which is detox as well as the ECP. Come to one place and stay for 40 days and get it done. Then you don't have to worry about anything. Just do one thing and you can concentrate on that. So that is possible. That is possible.
Deepak, we go to the next question.
So anyway,
because there is lot
I'm going to
of
go to.
question
Yeah,
on
hang
the
on.
chat.
Just wait, one second. Let me get through. So I have a couple of 3 questions, Doctor. The creatine, having a creatine reading higher, what does it include? Creatine is basically waste product not coming out of kidney and washing it out. Is that true?
Exactly. The kidney, when not work to the fullest extent, then the creatine gets accumulated in the blood, and this is an indication that your kidney is under pressure. So creatinine till 1.3 is good. After that, it is not good. And mostly the cause of high creatinine is high blood pressure not controlled for a long time, or high blood sugar not controlled for a long time.
And creatine gets created by taking extra protein in your food, or uh,
Yes.
protein powders and stuff like that.
One is the kidney is not excreting it. Plus, if you put a lot of food, which has more creatinine, even meats have a lot of creatinine. So you have to cut down the proteins and the meat and any kind of alcohol. They are not good for creatinine.
Okay. That was one of the questions. Second question is the um, Dr. Gantry talks about polypheno reduces the plaque. And he's saying that olive oil, I mean, he talks about Mediterranean diet, and he's talking about the using a lot of the olive oil should be included. How does it differ? His approach and your approach, how does it differ?
See, the Mediterranean diet has lot of fruits, lot of vegetables. They have antioxidant, polyphenols. They are good, and they may be responsible for improving. And in those Mediterranean countries, the stress was not so high, so there were low number of heart patients. But olive oil is like any oil, and they lead to blockages. They are all triglycerides. Remember, the triglycerides have three possibilities: saturated, monounsaturated, polyunsaturated. And
Correct.
problem is the difference is only one hydrogen. When all the hydrogens are present in that oil, then it is called saturated oil. If one is absent, then it is monounsaturated. Two is absent, then polyunsaturated. If I give you three vegetables made from three kinds of oils, you will never be able to find out which one is saturated, which is poly, which is mono, because there are hardly any difference between the three. All three are harmful. All of them lead to blockages. So this olive oil concept now is falling short of the logic.
Okay. That makes sense. Yeah. Ah, the three people are promoting reversal of the plaque or heart disease. One is Dr. Dean Ornish, who you have worked with, and Dr. Coldwell, and Dr. Gantry. Gantry is pretty much, he was a heart surgeon. Then he decided.
Esselstyn, Dr. Esselstyn never allows oil. I have been with him. I met him. He is one of
True.
the very ardent supporter that no oil to be taken.
Correct. That is true. But what I'm saying is, Doctor, yeah. So these are the two people you have studied and you have met with them. How does that program coincides with what we are doing? What are you doing, or your approaches?
We have done what we have done little more than what they advise. We have
Okay.
controlled the 14 factors together, and we have one is Indianize the process. So the food habits that we have in India or Indians are different from what they have in US. So that we have changed. In India, we have been popular because we have been able to spread to so many people. So if they have, worked on 1,000 people, we have worked on 100,000 people. So it's a lot of more, spread across India because the acceptance of the therapy is much more. In Indians,
Okay.
it is in US, when you talk about yoga, a lot of people may not be so. And when you talk about vegetarianism, a lot of people have problems. But when they have heart problem, they will change. I talked to Esselstyn, how can you get all these Americans eat vegetarian? He said, doctor, when they are thinking of dying, they will do everything.
That's true. That is true. So now, doctor, if somebody wants to come, or you would like them to have a consultation over the phone first before they come here, or
I
how does that happen? What happens?
lot of
What's the
patients
step?
we have lot of patients who come from US, Canada,
Yes.
UK. They first do a video consultation, online consultation. So that is very
O-
much possible. You go to
Okay.
our website.com,
Okay.
scienceandart.com, and from there you can book an appointment. and then we can talk to you, explain, your whole thing and see your reports. And then they can travel all the way to India. It will be much cheaper than if they do anything outside. Even going to an ER would cost more than what the whole treatment in India would cost.
Absolutely, absolutely. So what? So they do the phone consulting, then they will confirm the accommodation, and then they do the booking. And well, somebody just asked me, "Do you have 10? Can they come for 10 days or 20 days or 40 days?" How? But I said that depends on what depth of the disease you have. Is that correct?
Yes.
Okay, so they can, that is determined after the consultation is done, how many days they need to stay to correct themselves.
I think, yes, more or less right.
Yeah, and what the things they would get here is the oil-free food. They learn how to make oil-free food. They get the yoga exercise. They do lifestyle change and cooking classes and whatnot. And the benefit having everything done in under one roof, it's easier to control, and they see the results. Now, how do you?
The beauty, you are getting dietitian, you're getting yoga teacher, you're getting cardiologist, you're getting everybody together at the same platform at such a low cost. So it works for everybody and everybody can reverse.
Now, if somebody wants to determine after attending for so long that how much they've reduced, what is the easy way to find out that it is?
After a few months, we recommend them to go for a CT angiography to see the blockage reversal, how much it has happened and how much improvement has taken place. And
Okay.
obviously,
Dipak bhai, this is Subhash Bhatt. Can I ask a question to doctor?
Sure. Subhash bhai, go ahead,
Yes,
please.
thank you.
Yeah.
Doctor, lately the medical doctors in USA have introduced a new enemy of heart, that is lipoprotein A. Can you shed some light on that?
lipoprotein A should be below 30, but it is a genetic predisposition towards heart disease. And Indians have this lipoprotein high in many cases. About maybe 60-70% of the Indians have lipoprotein A, small a. It is called lipoprotein small a. And this is also going along with cholesterol and triglyceride. But the problem is lipoprotein A is genetic and we cannot modify it with medications. So even if you control the cholesterol triglyceride to the fullest, the lipoprotein A cannot probably go down. So we always tell people they are at disadvantage, but reversal is still possible, even if you have more than 30 lipoprotein A in your blood. So this test is now available. And I must tell you, this is about 20-30 years back that lipoprotein A was talked about, and still now it is being talked about.
Well, as I understand, 2 weeks ago, FDA in America, USA, they have approved a drug to reduce the lipoprotein A, which is based on mRNA technology, which is the same as a vaccination of this COVID.
Possible. See, now the gene modification, there is a cholesterol lowering injection, which one injection can reduce the cholesterol for 6 months. So you don't have to take statins, you take that injection, and it works for 6 months. So twice a year. But in India, the problem is the injection is about 1 lakh rupees. So I think, and that also works through mRNA. So I don't know. I exactly have to find out if it is 10 days. Maybe I have not read about it. But if it is good and if it works and if the FDA has approved, it should be good.
All right. Thank you, doctor.
Okay. Anybody else?
મારે
Any
એક question
Yeah.
હતો.
Paruben, please speak in English, please. Don't talk in
Yeah, I
Gujarati.
had one
Yeah,
question.
okay. Sure.
That for getting reversal of this, as I told you, we don't know whether it's a 90% blockage or whatever. So before that, suppose we do take EECP here, how many times you need to do it so that
35
you know?
35 times minimum, 40 is most ideal.
40 EECP treatment, 40 of that is
Per
Yes,
session.
continuously, not
every day,
taking.
once a day
Yes, every day, yes.
for 40 days.
40 days, yes.
Okay. Okay, so we
Okay.
don't need to ask our cardiologist. We can just go ahead and
Who
start.
will recommend So those who do it, they know who will recommend you so that you can get the money, reimbursement.
Okay.
Yeah.
Okay.
Okay,
you.
go ahead.
Dr.
Can I ask
Chhajer,
can I ask a question?
Yeah.
Rita Bhavsar, go ahead. Rita Bhavsar, please go ahead.
yeah, thank you, Dipak Bhai.
Yeah, Rita Ben, go ahead, please.
I
Yeah,
had a quick question. Now,
sure.
many of us, I am almost vegan, so I tend to drink instead of milk. You know, we have almond milk and other things. So, uh, is it okay to have almond milk or coconut milk?
If you consider it, scientifically, need about 2 to 3 grams of almond powder to add into 1 glass of water. So 3 grams of almond will give you hardly less than 1 gram of fat. So almond milk is better than normal milk. So you can go, and oatmeal is still better.
I see. Okay. And what about that means? Uh, sorry.
Oat milk can also be preferred.
Okay. And what about eating? One of I see in the comments that what about the avocados? And it is very high cholesterol, right?
Avocado has been very much highlighted for heart care, but it is not. It has got 16% oil. If you just Google the fat content of avocado, it's got 16% oil. Chapati has 1%, dal has 2-3%. Though avocado is so 16 times more fat in the blood. So avocado is not a very good thing to happen. People say, oh, omega-3 and all that, but you cannot think of one good thing and so many harmful things in that. So you have to balance. You cannot have one, you can take the only good character and leave the worst character. It cannot happen. So avocado, I don't recommend.
And another, my daughter has been, like, okay, as you age, that you have to eat a lot of protein. They are just after us. So what do you suggest?
Nowadays, cancer is very much related to high intake of protein, the animal
Yes.
protein. So even dal and all you can take about, we say about 1 gram per body weight, per kilo of.
Not about, I'm vegetarian and I'm vegan. So, but, what kind of protein then we can?
On changing the dal, you can take tofu, you can take
Oh,
soybean product, good enough for
okay.
you.
Okay.
Okay.
Yeah.
Okay.
Thank
Deepak,
you.
we
Any,
just allow one
I,
question at a time because there are so many people who
yeah,
are.
Can I,
correct. Go ahead. Who's the next?
can I ask a question, please?
Yes.
Yeah, okay. Hi. My name is Rosie, and I want to know what's the normal calcium score, and can it be reversed, or is it dangerous for heart attack?
Calcium score is not at all bad for heart attack, but it indicates that you may have deposits of cholesterol. But if the calcium is more in the deposits, then they become resistant to breaking because calcium gives strength to the muscles. Now, calcium score depends on the age also. The more you age, the more the calcium score. I have got people who have got 5,000 calcium score and still have no problem with heart disease. So calcium score, don't worry so much. But a CT angiography and find out if the blockages are actually there or not. They only
Okay, but
indicate
sorry,
that the
go
block.
ahead. Can that be reversed?
Calcium usually grows with age. So don't expect a lot of things to happen in calcium, but blockages can be reversed. That is more important.
Okay, thank you.
Next question.
I would like to ask,
Go
I'm
ahead.
Daisy Fitter, and I would like to know that which cooking oil will be best. As you said, like
None.
In, in, in India, we have oil, SAAOL oil, and which is also available in your home. And this is the SAAOL oil.
Is the
so
water.
we are
It's a
like
plain
which
water.
The best in India. And there is a video which I can show you right now. This is called Zero Oil Cooking. We've got a 1 minute video which has gone viral all across in Instagram, 500 million views. And if you want,
500 million. Doctor, that's a record. 500 million.
people have seen this video. And if you allow 1 minute, I'll just show you.
Sure, sure. No, let's go for it. Let's go for it.
तो पहले तेल डालते हैं सब। हम लोग बोलते हैं पहले जीरा डाल दो सीधा। अब उसमें प्याज खाते हो तो प्याज डाल दो। प्याज में जीरा चिपक जाता है। अब प्याज को भूनते रहो। जब पानी छूट खत्म हो जाए तो थोड़ी सी आधी चम्मच पानी देके भिगो दो, फिर भूनो। अब इस प्याज के ऊपर हल्दी, धनिया, मिर्ची, नमक, अदरक सब डालो। कढ़ाई में डालेंगे जल जाएगी, पाउडर है कढ़ाई का। तो प्याज के ऊपर डालेंगे जलेगा। और उसमें 1 चम्मच पानी देके उसको सबको उसके ऊपर लेयर बनवा दो। थोड़ी देर बाद टमाटर डालो, टमाटर का पानी खत्म होने दो। अब जो एक पेस्ट बन जाएगा, इसको भूनते रहो जब तक स्वाद ना बदल जाए। एंड देन दिस टेस्ट इज इक्वली गुड, क्योंकि मसाले वही है, भुने हुए हैं। अब ये जो कुकिंग है, इसको हम लोग बोलते हैं जीरो ऑयल कुकिंग। अच्छा, पैसे भी बचे तेल के। हम लोग ने 1000 रेसिपीज बना लिया, आई गॉट कुक बुक्स। हमने 50 दिन की अभी मेनू यूट्यूब में डाला है। कढ़ाई गर्म हो गई तो पहले तेल डालते हैं सब। हम लोग बोलते हैं पहले जीरा डाल दो सीधा। So this is the cooking method, and you can go to our, as I told you, we have a YouTube channel called Zero Oil Cooking, and you can just learn from there. And we have got 50 days menu. Only repetition is chapati and rice. Other than that, all the sabjis, all the dals, every preparation for breakfast, lunch, afternoon snacks, and dinner are there for 50 days, different, and all of them without oil.
Sir, can I go ahead with asking one question?
Sure,
Yes.
go ahead.
Sir, yeah, I'm Jyoti Ramchandran from Mumbai. What is left ventricular hypertrophy? And
Okay, let me give you
yeah,
what is left hypertrophy.
yeah, and how to deal with it, and what would be the symptoms?
It does not have a lot of symptoms, except when you do a echocardiogram or ECG, it can be detected. Usually what happens now, our blood pressure is 120. So heart has to pump 120, so it has to create a 121 pressure when they pump, and the blood will flow into the muscle, into the whole body. Now, if you have a high blood pressure, supposedly 140 or 150, heart has to create 151 pressure, so it has to work hard. And if heart has to pump 1 lakh times in a day, 100,000 times in a day, and year on you have got high blood pressure, then the heart muscles will hypertrophy. It is something like you go to the gym and you do 100 times, weightlifting, the muscles of your arm will become thicker. So left ventricular hypertrophy is mostly due to the high blood pressure, and if you control the blood pressure for 2, 3, 4 years, the hypertrophy will reduce. Similarly, like when you stop doing gyms, the muscles become little less and less, thick.
So, but do you feel some heaviness? Will we feel some heaviness due to that?
Along with that, you may get a heart problem as well. So it is better you are in Bombay, just contact any of our centers. They will tell you how to get this angiography. If the CT angiography does not have a blockage, don't worry.
Okay, sir.
Okay.
So how do
Over
I get
next.
the contact? From the site I can get it, no?
Yes, you can. Mhm.
Okay.
Punita, can I ask one question?
Okay.
Yeah,
Thank you,
go
sir.
for it.
Doctor, this is not regarding heart, but you said that there is a oil in every food, right? So then why
Every
our
vegetable fruit.
synovial fluid get decreased in osteoarthritis cases, and it is continuous pain is there?
Our joints, when they suppose somebody has a aging, lot of wear and tear in the joints. So even if the synovial fluid is not so much less, the bones, hit each other when they walk. So you get pain. You will never see somebody putting oil or something into the joint to improve the joint. But they will say you reduce the weight, you improve the muscles, so the joint problem will improve. Synovial fluid is made by something called collagen and one hyaluronic acid. And that hyaluronic acid can be improved by some medicines which we give from outside.
That is gel injection?
No, they can be given tablet form also.
Okay. And what about creatine tablet? Creatine powder, they said that also improves muscles and bone creatine.
I don't know exactly, but for improvement of muscles, exercise is the best thing.
Okay, the last
Nowadays,
question
TKR
Yeah,
is so much,
yeah,
every day
let's.
the doctor says TKR, go for TKR, total knee replacement.
Uh, Punita,
Like,
let
Okay,
Ajay
let
Bhai.
me
Ajay
ask
Bhai
you
has the
one
last
last
question.
question, doctor.
okay.
Yeah, Ajay Bhai. Ajay Bhai, go ahead. You have a
No,
last
hold
question. Go
on,
ahead.
hold on 1 second,
Yeah.
1 second. Only one question. What is the best way to have in the lifestyle to eat, like from breakfast to dinner?
See, the best is obviously you have the breakfast with a lot of fruits and maybe one brown bread or something like that, and take juices. In the lunch, you should go for maybe chapati and rice. That's the Indian way of eating, and you can prepare the vegetables without oil, dal without oil.
Mhm.
In the You can take a snacks like this makhana, which we call makhana.
We know makhana. We
Yeah,
do.
yeah. Makana is makana. Yeah.
In the
Okay.
evening.
Ajay Bhai. Yeah.
And for
Ajay Bhai, go
dinner,
ahead.
Deepak, wait,
Punita,
just
one
wait.
second. Punita, 1 second. Let Ajay Bhai come and ask question. Go ahead, Ajay Bhai. Hmm. He's muted. So, okay. Go ahead, Punita. Go ahead. Sorry. Go
Now,
ahead.
the last one, like for the dinner.
For the dinner, best is of course soup and boiled vegetable if somebody is obese. If he is a normal weight, then in the evening also you can take some cereal in the form of chapati or rice or khichdi, something like that.
Okay.
Okay.
Okay, if anybody has it, otherwise we are fine. Ajay Bhai, are you there?
Yes.
Yeah, go ahead.
for
Go
it.
ahead, Ajay Bhai.
All right. So I am going to do the final thanking ceremony. Dr. Bimal, you had a very good courage to come to the Gujarati audience predominantly and tell them not to eat the oil. That requires less. It's like going to the bar full of alcoholic people and say, "Hey, don't drink alcohol." It's going to be tough, right? But no, the lighter side aside, it has been a great learning session, especially what we have learned, we will definitely try to implement. We thank not only you, but also our host, Punita Ben and Dipak Bhai, and Munish Bhai, who has been working behind the scene, bringing all of us together and giving the technical support. Thank you, Munish Bhai, for that. And our audience of more than 75 people who have come together for this. So what will be the important lesson that I will be taking is that 14 holes that you talked about, especially we will learn more about them. We will request Munish Bhai if you can share this with all of us, this recording, so that we can learn more about those 14 holes that he talked about. And Sure, sir, sure.
books are available on Amazon. We will definitely buy from there. Otherwise, whenever any of our member comes to India, we'll buy from there. Thank you very much again for your very informative, and we really thank you for your selfless service to the entire, not only India, but all to the entire world. Thank you very much.
Dr. Chhajer, just to make you happy, and that's the truthful. Yesterday, I cooked everything without oil.
Awesome.
Okay. Thank you, Munish Bhai. And next
Munish
talk.
Bhai.
Yeah, Munish Bhai, thank you so much for organizing IT part of it. And next talk, we're gonna have it in September, and we'll announce who's the speaker is gonna be. Okay.
Yeah,
Thank you.
Punita Ben.
Yes. Hi, Rosie.
Hi, can you please share the recording with us? I want to
Yes,
share.
I will. I will go
Recording
ahead
will be
and
posted
post.
on our WhatsApp groups. Yeah.
Okay.